Hi, hello, my name is Corry Arcomano and I'd like to welcome you all here today. My research question is, as more people look towards surgical alternatives, which therapeutic needling treatment is more effective, dry needling or acupuncture? So before we begin, I want to start by giving a little bit of context to why I'm asking this question, why this question is important, and the kind of beginnings of my interest in this question in general. And I want to start by saying that, at least for me, and I hope for all of you, I think that pain is a really fascinating thing. Excuse me, yeah. The prick of a needle, a muscle spasm, the breaking of a bone, something so sudden and so quick, just like that, can oftentimes have its really long-lasting effects, and it leaves us, as humans, in total shock. And it also leaves us constantly seeking help. And I think that seeking, that fascination with pain, and the seeking of help in general is what I credit to be the earliest forms of medicine. And one of the earliest forms of medicine, the third oldest form of medicine, is called traditional Chinese medicine. And it still exists today, and as kind of time has gone on and it's evolved, there's a subset of practitioners that have diverted from it. And these subset of practitioners have kind of gone on to do their own things, and they have created what's called Western medicine. And these two topics have kind of been in controversy and have kind of been battling for quite some time. But before I kind of go into what these are contributing to and what's going on with these practices, I can use one word to describe each of them. For traditional Chinese medicine, the word I would use is holistic. When a traditional Chinese medicine practitioner is looking at their patient and the patient has an injury in their shoulder or something like that, the practitioner is looking at the shoulder and they're saying, well, what's going on within the entire human body? What's happening around the human body that's contributing to this injury? Now, the Western medicine practitioners are asking what's going on in the specific place, what does the evidence say about that injury, and how can we treat it? So as you can tell, I've been interested in this kind of comparison for quite some time, and how these two things have been working together, the kind of contrast, the evolution of one into the other. But I had trouble originally trying to make sense of it. I didn't know where to start because these topics are so broad and so big, and there's a lot to cover. That was until, in the early stages of my research, I read two studies that showed something really interesting. The first study that I read was a systematic review conducted by Pain Medicine and published to the Oxford Academic, and it included 6 trials with 277 participants total. And in this trial, they analyzed the placebo effect in orthopedic surgery. And for those of you who don't know, the placebo effect is basically a remarkable medical phenomenon in which a placebo, or a fake treatment, can sometimes improve a patient's condition simply because that patient has the expectation that it will improve their condition. So, hypothetically, if I think that someone smashing me on the hand with a hammer is going to help, cure my shoulder pain, it is entirely possible that someone doing that will help cure my shoulder pain. That's the placebo effect. So in this study, they found that there was the placebo surgery was shown to be just as effective as actual surgery in reducing pain, which is remarkable because a practice can't be truly effective if it's not distinguishable from placebo. Because that means that if I go into the practice thinking that it'll work or that it won't work, it'll depend on how I feel, not how the practice actually works. So for a practice to be truly effective, it needs to be distinguishable from placebo. Now, the second study that I read was a contrasting meta-analysis conducted by the Department of Orthopedics at the Second Military Medical University in Shanghai. And this study specifically focused on chronic back pain treatment, and even more specifically focused on the treatment of chronic back pain surgically and non-surgically. And they used this form of measurement in medicine called a VAS, Visual Analog Scale. And basically, like what you'd see in your doctor's office, you walk in and there's the pain scale, and they ask you on a scale of 0 to 10, how do you feel? 10 being the worst pain, 0 being no pain whatsoever. So that's a really effective measuring tool. But in this study, they used the VAS scale, and they found that patients scored and felt better in the non-surgical group than in the surgical group, which I thought was really significant, and I was interested in what was going on in the non-surgical group that was causing it to be so effective. So I dug a little bit deeper, and I found that one of the commonalities through all these studies that were in the meta-analysis was that dry needling and acupuncture were both used in the non-surgical group. And I had known about dry needling and acupuncture because I had spent time in a physical therapy clinic where they practiced dry needling, and I had spent time, free time, time seeking the pursuit, trying to get healthy and things like that with acupuncturist practice on myself. So, relating it back to traditional Chinese medicine and Western medicine, these two practices are playing out on much smaller scales. But what are they? There we go. So we'll start with acupuncture. Historically, acupuncture, when it first began, before even the birth of Christ, it started as a religious practice to rid the human body of evil energy, or as the Chinese people would call it, evil qi, and eventually inherited the four main components of traditional Chinese medicine, which is inspection, visual examination, auscultation and olfaction, which is hearing and smelling, and inquiry. So these, again, if you think back to what I was talking about, these are the holistic approaches that traditional Chinese medicine practitioners take. And now the practice, as it's kind of evolved over time, is used to shift a person's unique climate and the way that energy flows in their body. And they do this by inserting these fine needles into what they call trigger points or meridians on the body. So these are precisely defined trigger points where there may be blockages of energy, so they say. So these are the trigger points, and that's the actual practice as it is. Dry needling, on the other hand, Dry needling was originally developed in the early 1940s, and it wasn't used as an actual therapeutic needling practice. It was originally developed for therapeutic liquids to be injected into muscles, like steroids and certain things to help heal muscles and things like that. But it was later proposed that the needle itself could be used in treating certain muscular or myofascial pains. And so they insert the needle into myofascial trigger points, and myofascial means muscular. So these are trigger points on your trapezia, splenius, capitis, or capillitis, or something like that. But certain trigger points around your back area that they insert the needle. And the needle is often paired with electric stimulation, which acts as a sort of way to reset the muscle. So when the electric modality is paired with the needle, it's used to kind of create a thumping sensation in whatever muscle it's targeting, and it resets the muscle. So we know what they are. We know that they're more effective than surgery, but which one is more effective in general? Which one is truly the effective practice? To answer this question, I focused on two of the most debilitating myofascial or muscular injuries that we know. The first is chronic back pain, and the second is adhesive capsulitis, which is called frozen shoulder. We'll start with chronic back pain. Chronic back pain is almost always muscular. There's a few times that it's nerve-related, but it's almost always muscular, and it's the single leading cause of disability worldwide. And it's chronic in the medical community. It's defined as chronic when it lasts for more than 3 months. If you have back pain for a couple of days, it's not chronic back pain. So to see which one was truly better, I analyzed 2 studies. The first study tested the efficacy, the efficiency of dry needling in treating chronic back pain. It was conducted by the Journal of Physical Therapy Science, and it used that same VAS, visual analog scale, that we were talking about before, the pain scale that you'd see in the doctor's office. And this study compared dry needling to a control group, which is basic physical therapy, manipulation, exercise, massage therapy. And using this VAS scale, they were able to create averages. So you'll see that the pre-treatment scores for the dry needling group were 7.1 plus or minus 3.4. So on average, patients were in a fair amount of pain, but their post-treatment scores were 0.6 plus or minus 0.9, which is a significant, as the researchers defined it, a significant decrease in pain in patients. And now this is versus the control group, which is 7.8 plus or minus 4.0, again significant pain, which resulted in 3.8 plus or minus 1.0. Which is, a decrease in pain, but nowhere near as significant. Although that's not the comparison we're trying to make. We're trying to compare dry needling to acupuncture. So, the second study that I read tested the efficacy of acupuncture in treating chronic back pain. And it was a meta-analysis, a culmination of studies, and it was conducted by the Journal of Orthopedic Surgery and Research, and it tested acupuncture against no treatment whatsoever. It used the same VAS scale. And the researchers found that there was only a slight increase in effectiveness in decreasing pain as compared to no treatment whatsoever. And the researchers even said that if patients were to seek no treatment or seek acupuncture treatment, it wouldn't make that much of a difference. So you compare that to dry needling, and it's clear to see that dry needling in this case in treating chronic back pain is the more efficacious practice. So we turn now to adhesive capsulitis. And adhesive capsulitis is called frozen shoulder. It's basically the swelling and thickening of the shoulder joint. Things get tangled up where they shouldn't be. all that fun stuff. And so to answer this question, which was truly more efficacious, more effective, I pulled again from 2 studies. The first study tested the efficacy of dry needling in treating adhesive capsulitis. And it was conducted by the Journal of Orthopedics and Sports Physical Therapy. And it tested 1 individual patient for 13 sessions total. And it used the same VAS scale, but they also tested range of motion. And range of motion is basically testing whether or not the shoulder can move, a certain angle. This is 0 degrees, 90 degrees, 180 degrees. And they use basically a protractor, or a goniometer as they call it. And in this study, they found that there was a 70-degree increase in the range of motion in the dry needling study. And the patient started with a VAS score of 7, so again, moderate pain. But by the end, the patient had a complete alleviation of pain, finishing with a VAS score of 0, which is significant. And the only drawback to this study was that it was conducted with 1 patient, so they need to pull data from more patients. But it's a promising, start. And the second study tested the efficacy of acupuncture in treating adhesive capsulitis, and it was conducted by a medical association called Materia Sociomedica. And it tested 40 patients over 3 months, and it used the same VAS scale, tested range of motion with the protractor, and they found that there was only a 50-degree increase in the range of motion as compared to the dry needling 70, so not as good as the dry needling group. And the patient started with an average VAS score of 8 plus or minus 1.2, so again, a significant amount of pain, but they finished with a 3.3 plus or minus 0.8. And that plus or minus 0.8 means that at no point did a patient in the acupuncture group feel a complete alleviation to pain. So that is a really significant comparison to dry needling. Okay, so now what? We know that dry needling is better in treating chronic back pain. We know that it's better in treating adhesive capsulitis. But that doesn't really mean anything because these are just 2 injuries and thousands of injuries that you can get. So I wanted to look a little bit bigger picture and see something that could truly test the efficacy of the practice. And that is looking back at the placebo effect, as we talked about before in surgery. And I wanted to compare dry needling to its placebo counterpart and acupuncture to its placebo counterpart to see which would be truly the effective practice, because as you'll remember, practice can't be truly effective if it's not distinguishable from placebo. So I drew again from 2 studies. The first study was tested dry needling against its placebo counterpart, and the placebo was the sensation of the needle felt, but no skin penetration whatsoever. So the patients couldn't see that the needle was being inserted, but they could feel it, so they believed that it was happening. And it was conducted by a Department of Physical Medicine and Rehabilitation at the Gulheim Medical Military University. And it was 39 patients split into the placebo group and the study group, and they were tested multiple times. In the early versions of the tests, there was no real difference between the scores, the VAS scores that they used, between the patients. But in the later tests, they found that dry needling had a significant decrease in pain as compared to the placebo. And the study's ultimate conclusion was that dry needling is a much more effective practice in relieving pain and improving the quality of life as compared to its placebo counterpart. The second study tested acupuncture against placebo acupuncture, and then both of those against no treatment whatsoever. And it was conducted by the Nordic Cochrane Center, and they used the same VAS scales that we've been talking about. And it was the same placebo as in the dry needling study, where the patient didn't feel the actual needle puncture their skin, but they did think that something was happening. And so they compared and averaged out all these scores, and they concluded that there was a really insignificant difference between acupuncture and placebo acupuncture. There wasn't anything there. And there was only a moderate difference between both of those compared to no practice. So when we compare dry needling to acupuncture in regards to placebo, dry needling is truly the more efficacious practice. All right. Overall, which is more effective? It's pretty clear to tell that even when we're talking about these debilitating injuries or placebo in general, dry needling is truly the more effective practice in general. And so there are really 3 things that I want to leave all of you with. The first thing is that, as we've established, dry needling is a more effective practice, and it has a brighter future than acupuncture. There's a study that was conducted where acupuncturists were tested, polled, and the statistics show that acupuncture is a declining job. The market is not as high as it used to be, whereas dry needling is at a 30% growth rate, and it's increasing steadily. The second thing I want to leave you with is that, as we've also established, surgery is awful. It sucks. Just ask Ben Black there. He'll tell you all about it. It's horrible, so don't even try going for it. And the third thing is that I'd like to reiterate the idea that we talked about earlier, traditional Chinese medicine and Western medicine, and that happening on a much smaller scale. Traditional Chinese medicine is evolved into Western medicine, and it will continue to evolve, and the evolution of medicine will play an extremely important part in our future as humans as we continue to seek this help. The evolution of dry needling will also continue, and as it does evolve, it will spread out. And practitioners will focus not only on myofascial injuries, but nerve-related injuries and different injuries in general. So it does have a bright future, and I just hope that you all, as I do, feel excited for the future of medicine. Thank you.